Now, if you guys have been dealing with hip impingement or groin pain for a long time, you probably wondered, maybe I should just get a surgery done. It seems like it's not getting any better, but how do I know if surgery is the right thing? Well, it's important to know that you should make a surgical decision based upon a few factors. And here at Performance Place, we do a full screening and assessment to figure out if this person reasonably will fare well to physical rehabilitation versus a surgery. I'm not going to say necessarily that we're going to make it so the assessment won't tell you need surgery, but it'll certainly tell you if there's options in rehabilitation that you can exploit first. So we're going to go through that assessment today, and you guys can use the logic moving forward when you make a decision for yourself. Hey everyone, I'm Sebastian at Performance Place Sports Care, part of the locally world famous chiropractors in Costa Mesa, California. Now, at any point in this video, if you decide you want help from us, we do see people virtually or in person. Usually for an assessment like this, we usually do in person to make sure that we can actually have a little bit more control over what we're stress testing. The important thing when we're doing things like assessment of the actual hip is you have to stress test things. If you don't stress test things, like say I hurt my finger and I bend it backwards and someone said, well, you sprained your joint, and I move it around and it doesn't really hurt in any range. Did I really sprain my joint? Like, did I sprain my ligament? Because I'm stressing the ligament and it doesn't hurt. And so stressing the passive structures such as the ligaments and the contracting structures of the hip can be very helpful to assess if surgery is going to be needed or not. Also, too, there's a webinar in the corner. Please take advantage of that. It's very, very useful. So usually we'll assess people using the logic of if the hip exam looks generally normal and they have pain, but the ranges look okay compared side to side, then that's going to be a rehab case. Now, if somebody has pain and a stiff loss of range of motion with passive movement, then that may be more of a surgical case probably, but they still have to fail conservative rehabilitation first. And so I'll give the demonstration first of this way when we have, say this is the hip we're testing. As the examiner, I would move through this range first just to see what happens. As I move through it, is it fluid? Does it feel like a block of cheese or a block of wood in any range? Can I turn it? Can I turn it? Can I drop it down? Can I push down on it? And so on. So we're stressing different things. Most of the time we find people that have not just hip impingement, but arthritis of the hip that's a little bit more surgical need. They have something called Dremen sign. And so you go like this, I'm pushing it up and it just drifts out. And I'm like, what? Maybe I could, like it doesn't go in. Like this area, something here is blocking it. And so essentially people who even go through this range here and they have like a little limitation and they say, yeah, that hurts, or ow, that hurts, but you still have the range. Usually this is going to be more of a rehab case, all right? Now, if you test the passive or the active stretchers, we have them push, we have them push, we have them push, and we have them push pretty hard. Reasonably speaking, if they can push here, that's not their hip flexor tendinopathy. It's not a hip flexor tear. It's not a hamstring tear. It's not a quad tear. It's not an adductor one or an abductor one or so on. So there's ways to test it, okay? So if we use that logic, again, I can't stress thinking this enough. Is my range of motion, let's just say this is the test too, is my range of motion the same but it hurts, or are they dramatically different and it feels stiff that I can't push through? For a lot of people, the loss of range of motion plus the end feel of the range of motion, not just the fact that they lost it, if we can't get the range back, then the purpose of the surgery is to get the range back. It doesn't always address the pain, sometimes it will, but when people don't have a loss of range, but it hurts to do the range, like this is normal range for me, but it hurts when I get to the end, if there's no loss of range, why are we doing, there's really no big need for the surgery. Pain is just pain. All right, pain is a feeling. It's not always attached to a structure. I know it's an odd thing to say, but pain is easy to go away for most people. Range is a little bit harder to come back. But reducing pain doesn't have anything to do with restoring function. So usually at Performance Place, we find that if we can help reduce someone's pain, sometimes the range comes back if it was lost. Other times, like when we do an assessment on people, we can generally see pretty well. It's like, okay, that's pretty stiff. That's not going to come back. That's okay. You may or may not decide to have a surgery on that, but let's try a course of conservative treatment, rehabilitation, stretches, exercises to see if we can make it so you don't need the surgery. And if it comes down to it and there's no progress over the course of about a month and a half, then yeah, that may be more of a surgical case, or at least do a surgical consult. But for a lot of people, pain reduction can happen very quickly, but we're always honest with them that a lot of times if it feels like a block of wood, not a block of cheese in the range, then that may not come back. But that doesn't mean you can't function and have a good life either. Okay, so rehabilitation, I'd say 9 times out of 10, doing a good program to figure out what to do, but also to create strength and stability in the right areas of your body to take workload away from the hip is the long-term answer. I'd love to say that reducing pain is the only thing that you need to do, but it certainly makes life more comfortable, but it does not change function, all right? They found that even after hip procedures like hip replacements, like people still walk with an altered gait. Their strength doesn't change. That's why there's subsequent activities you need to do, such as glute exercises and so on after the fact. And so if you guys want help, an assessment like so, we're in Southern California. We have people who fly in sometimes and go to Disneyland or the beach, pretty close to that. We'd love to see you and do an assessment on it. We can do virtual sessions as well. As you can see, there's ways to look at things and ask how you feel, which is a form of assessment as well, but nothing substitutes hands-on. So please come see us, reach out to us in the link description below, and subscribe to the channel so you can watch the remainder of these hip impingement videos that we have on YouTube. We've created a whole series on it, and so we'd love to make sure that you have the best information that you can before you make decisions like surgery moving forward. Talk to you guys next time.